So, talking today about an introduction to psychological disorders. So, first, let's talk about defining abnormal behavior. So, what is a psychological disorder? Psychological disorder is a very broad term that we can apply to any condition that causes a person to suffer. So, it has to cause the person some kind of subjective distress, okay? Some kind of suffering is involved. It can be self-destructive. The ultimate self-destruction can be when psychological disorders lead to suicide, can seriously impair a person's ability to work. So we'll talk about this with schizophrenia, with personality disorders, to get along with others. We'll talk about this with substance use disorders as well. And in severe cases, can endanger others or the surrounding community. So a very broad definition. If we want to look at other ways to define abnormality, there are several different criterion that can be used. So first, we can look at a statistical definition. So if you look at the image down here of this, it's called the normal curve, and we talked about this when we discussed intelligence and how IQ scores fall into a normal distribution within the population, in that most people, about 70% of people, will fall at the mean, which is the average score of 100, right? So that's at that 0 right in the middle, and then within 15 points on either side of the mean. So the majority of people will fall in between 85 and 115 as IQ scores. As you move further out into the tails of this distribution of scores, you'll see that fewer and fewer and fewer people will have those extreme scores. The same can be applied then to abnormal behavior. So if we're using a statistical definition, we want to define abnormal behavior then as something that relatively few people within the population experience. So that's the statistical definition. Social norm violation. So each society has norms for behavior, right? These are expected patterns of behavior. When you violate these social norms, that could be indicative of abnormal or atypical behavior. So there is a norm within the United States that you should leave your house with clothes on. If you are leaving your house without clothes on all of the time, this would be considered abnormal behavior. Subjective discomfort. We touched on this in the initial definition here, but subjective discomfort, it needs to cause the person some kind of distress, right? It causes them some kind of internal conflict, internal turmoil. These are not fun things to experience, and then gets in the way of your ability to function normally. And this can be things like not being able to hold a job down, not being able to maintain relationships in your life as a result of the psychological disorder. So in trying to understand the criteria that are specified for different psychological disorders, people who are in the mental health field use a manual. It's called the Diagnostic and Statistical Manual of Mental Disorders, abbreviated the DSM. The DSM has recently undergone a new revision. The latest DSM, the 5th version, so DSM-5, has recently become available as of May 2013. I will be presenting some of the new diagnostic criteria in this particular chapter, so I'll let you know when the stuff that I'm presenting might differ a little bit from what's presented in your book, because your book is based on DSM-4. The previous version. But basically the idea behind the DSM is to be able to provide sets of diagnostic or descriptive criteria. It basically tells you what a particular psychological disorder looks like in a person who's actually experiencing this disorder. So as we go through the different psychological disorders, we will be using DSM descriptive criteria to describe these disorders. There are some concerns with the DSM. So first, it's possible that DSM allows for over-diagnosis, where, we're looking through the DSM and you suddenly think, oh my gosh, I think I have every single disorder that is in this entire manual. Additionally, labeling theory, or looking at the power of diagnostic labels, this is basically a self-fulfilling prophecy. And so one of the criticisms then of applying these diagnostic labels to individuals is that if we label a child, let's say, as having attention deficit hyperactivity disorder or ADHD, if we say to this child, you have ADHD, are we then basically telling the child the kind of behavior that we want to see from that child? We tell this child, you have this label, and so there's a strong possibility then that the child starts to behave in ways that confirm or support that label. So they're basically living up to that particular label. They've internalized that label. Confusion of serious mental disorders with normal problems. So as you will see when we go through the different psychological disorders, they are often variants of normal functioning. So everyone experiences worry and anxiety to a certain extent, but at which point does it become an actual anxiety disorder? Everyone experiences sadness to a certain extent, but at which point does it become clinical depression? So these are some of the things that we'll grapple with. And then lastly, the illusion of objectivity, in that diagnoses as they are presented in the DSM reflect current attitudes and prejudices. So for example, up until about the 1970s, homosexuality was included in the DSM as a psychological disorder. We now know that that is, of course, not the case at all, but nonetheless, these diagnostic categories are a reflection of the current values and attitudes within the field.